Yes, the EMTICS study has been a long endeavor that was performed in Europe in between 2012 and 2018. And it was a large multicentre study that aimed at investigating gene-environment interactions for the etiology and pathophysiology of Tourette syndrome. One of the leading studies, so a couple of the leading studies for the EMTICS platform has been to investigate and to try and give an answer to the long vexed question of whether specific infectious triggers could precipitate worsening of tics or even the onset of tics. In particular, we were interested in group A streptococcal infections, which have been involved in pediatric acute neuropsychiatric syndromes like PANDAS, for example. We have found, doing through prospective longitudinal studies of kids with already diagnosed Tourette syndrome, as well as their siblings in a vulnerable age period, but before any tic manifested, we were able to show that there was no significant association between new group A streptococcal throat infections and either the exacerbation of tics in already diagnosed kids, or in the onset of the first onset of tics in their unaffected siblings. We think that these studies have provided an important piece of information that should really discourage a systematic screening for streptococcal infections in kids with tics who have either the first onset of tics or have a temporary worsening of their tics. This might also save a lot of unnecessary resorting to antibiotic courses that are not justified in the absence of clinically overt streptococcal throat infection.